In this video, here's what we'll cover. What postnatal depression really feels like. Baby blues versus postnatal depression. How common it is, and who is most at risk. The symptoms, and how anxiety overlaps. What treatment can help, and why early support matters. Many of the mothers I see expected new parenthood to be hard. They expected the tiredness, the constant adjusting, the broken nights. What they did not expect was to feel so far away from their own baby, to feel almost nothing, where they had expected to feel love, to find themselves crying and not knowing why, or lying awake, not because of the baby, but because of a heavy, shapeless dread that would not lift. If that is you right now, I want to say one thing before anything else. Nothing is wrong with you. What you are feeling is not weakness, and it is not a sign that you are a bad mother. Underneath their distress, almost every mother I have sat with asks the same quiet question. What is wrong with me? And the honest answer is, nothing. You may be living with postnatal depression, and that is a real, recognized condition with real causes and genuine, effective help. Let me start with what it actually feels like. Postnatal depression is not just feeling a bit down. It has causes that are biological, hormonal, psychological, and social, all woven together. It is not a character flaw. It is not something you brought on by wanting too much, worrying too much, or not being grateful enough. It is an illness, and like most illnesses, it tends to get better with the right support. It is also different for everyone. Some mothers feel deeply sad. Others feel empty and numb. Many feel a relentless anxiety instead. That brings me to an important distinction between the baby blues and postnatal depression. The baby blues are very common, affecting most new mothers in the first days after birth. They usually begin around day 3 to 5, when the hormones shift most sharply. You might feel tearful, moody, irritable, and easily overwhelmed. But the baby blues settle on their own, usually within 1 to 2 weeks, without any formal treatment. They are a normal response to an enormous physical change. Postnatal depression is different in kind, not just in degree. It does not clear up in a fortnight. It lingers, and often it deepens. The feelings are more pervasive and more disabling, and they respond to proper support rather than simply fading. So if what you are experiencing is still there beyond the first couple of weeks, or if it is getting in the way of caring for yourself or your baby, please talk with your GP or midwife. What you are describing may well be postnatal depression or postnatal anxiety, and both can be treated. Now, how common is this really? Postnatal depression affects around 1 in 5 Australian mothers. Postnatal anxiety affects a similar number, and the two often travel together. You are not alone, and you are not unusual. What the figures also show is that some groups carry a higher risk. Mothers from culturally and linguistically diverse backgrounds, including South Asian and migrant communities, often face extra pressures. Social isolation, language barriers, being far from extended family, heavy cultural expectations about motherhood, and the struggle to find a clinician who truly understands their background. If that is your world, please know that help is available. Medicare rebates cover it, and I offer sessions in Hindi, Marathi, and Punjabi, as well as English. Let me walk through the symptoms, and how anxiety fits in. Watch for a low mood or emptiness that will not lift, a loss of interest in things you used to enjoy, and a sense of hopelessness. Watch for difficulty feeling connected to your baby, and for guilt and shame layered on top. On the anxiety side, watch for constant, uncontrollable worry, especially about the baby, along with intrusive frightening thoughts, and a racing heart or tight chest. In fact, anxiety is often the louder voice early on, and it is easily missed because it does not fit the usual picture of depression. When depression and anxiety appear together, good care looks at both. I do need to be clear about one thing. If you are ever having thoughts of harming yourself or your baby, please treat that as urgent. Contact your GP, call Lifeline on 13 11 14, or go straight to your nearest emergency department. Those thoughts are a symptom of illness. They do not reflect who you are, and they deserve immediate support. Finally, what actually helps, and why acting early matters so much. Cognitive behavioral therapy, or CBT, is the first-line psychological treatment for postnatal depression, and it has the strongest evidence behind it. It works on the harsh thoughts that keep low mood and worry going, and it rebuilds gentle, meaningful activity step by step. Acceptance and commitment therapy, or ACT, can help when guilt and self-criticism are loud. Mindfulness skills support both, and involving partners in understanding the condition can make a real difference. Getting support early is one of the most caring things you can do, for yourself and for your child. If any of this sounds like your experience, please reach out at Potentialz Unlimited in Bella Vista. This is an area of genuine clinical depth, and Medicare rebates make support accessible. You can read the full guide, or book an appointment, using the links in the description below. You do not have to keep feeling this way. Before you go, here's a quick recap of what we covered. What postnatal depression really feels like. Baby blues versus postnatal depression. How common it is, and who is most at risk. The symptoms, and how anxiety overlaps. What treatment can help, and why early support matters.